Doctors of Reddit, what is your craziest "how the hell are you still alive" moment? Story 1. Nurse here. Man in his 50s has brain tumor, has surgery to remove the tumor and a hemicraniotomy, which is where they take a chunk of bone from the skull and leave it out to relieve intracranial pressure. Man walks out of this and has a normal life. Man is walking around minding his own business. Building explodes, shrapnel flies. Shrapnel hits the man exactly where the burr hole was, travels through his brain, and gets lodged behind his eye. This man's still alive. It baffles me that of all the people who could have been hit by shrapnel, it happened to a guy with a missing skull portion, and it hit him exactly where it was missing. It baffles me even more that he survived all of this. Story 2. I'm an ER doc and went to see a hall patient with a complaint of toe pain. Sat down to really talk with the guy since it was a lull in my shift. Said his toe hurt because he dropped a knife on it. Asked him, "Were you cooking or what?" He looks up from his foot and I notice a thin red line on his neck, below his thyroid cartilage, the Adam's apple. My heart immediately sank, and then started pounding. It's really hard to slit your own throat without bleeding to death, but not impossible if you hit the trachea just right and it lines back up when you look down, which is exactly what this guy had done. He had cut nearly all the way through his trachea, the windpipe, and just the muscle in the back of the neck was preventing it from falling into his chest, causing him to die by suffocation. If that had happened, I wouldn't be able to help him. Not with a breathing tube, and not with any sort of surgery, since his trachea would be retracted into his chest. So very calmly, I called the cardiothoracic surgeon and the ENT, and got the guy to the OR, still looking at his toe to maintain the seal, for tracheal repair. He was discharged to the psych ward 3 days later, since this was an unalive attempt, but did well. I knew he had already decided to live because we had about a half hour to talk calmly with each other while waiting for the OR to be ready. If he had wanted to finish himself off, all he would have had to do was just look up at the ceiling. Like many patients in the ER, his story is poignant. His acuity wasn't immediately obvious, and there is morbid humor associated with the case. When we tell our trainees about it, we just refer to him as the Canadian. Story 3. I was in residence at the time, and it was the end of my shift. I walked past a guy walking to the front desk with a goddamn harpoon in his head. It came in from below the chin and got out through the top of the skull. Dude wanted to go harpoon fishing, and then there was an accident in the boat and he shot himself. So he turned the boat around, sailed ashore, got in his car, and drove to the nearest hospital, where he parked and walked into the reception. He was completely conscious and couldn't speak for obvious reasons, with his jaw being harpooned to his head. But his writing was highly legible. I heard he was sent home the very next day with no complications. Story 4. When my dad was in residency, he was helping deliver babies. One came out stillborn. It was a rough time for everyone. Dad had to carry the baby away, and the entire time he carried the body away, he did chest compressions. The baby started breathing again. Dad had to bring the baby back. By all accounts, the likelihood of that working was extremely low, as they had already done everything they were supposed to do for longer than they were supposed to do it. The parents had to go through some trauma therapy after that, and that's all I know about the story. Story 5. Had a patient who was having drinks and fishing at night. Well, a wave hit, and he stumbled right onto his pole, somehow impaling it through his eye and touching the back of his skull. Amazing that he survived it, given the fishing pole-sized crater through his brain on the MRI. Story 6. I know a gentleman who has both his carotid arteries completely blocked off. Obviously gets enough blood flow from other vessels to keep going, and I'm sure these other routes have developed over the years. But still, I remember reading the scan results and having to go over them one more, like 100% blockage? Okay, that's bad. Wait, and on the left and right? Damn! Story 7. I remember from high school health and fitness, the textbook mentioned the case where one of the astronauts from the tragic Apollo 1 fire. During the autopsy, it was revealed that he had over 90% blockage in several major arteries, but never showed any symptoms of it. The reason being, a lifetime of hard physical training had developed other vessels enough to work around them. So the point is, if you exercise enough, you can get away with eating poorly to a pretty large degree, I guess. Story 8. Our friend blacked out driving home. The last thing he remembers is pulling into the other lane to pass someone. The car flipped twice, and they had to cut him out from the top. He was unresponsive, and the EMTs were ready to call him dead on arrival. He broke a vertebrae in his neck and shattered his hand. They were floored when they realized he was still alive. If it had been one vertebrae higher, he would have been paralyzed. As it was, he walked out of the hospital less than a week later. He had been wearing a seatbelt, which is literally the only reason he's alive today. Story 9. It was my first day rounding with the surgery team, and as we approached a patient's room, one of the surgeons turned to me and said, "Check this out, this man has more than 70 abdominal surgeries." We walked into the room, and the first thing I noticed was that it was really homey, which is unusual for a hospital. He had some aromatherapy going on, and pictures taped to the wall. A guest cot was set up with several pillows from home and a nice knit blanket in the corner. It was clear that he had been there for a while. The patient was a somewhat overweight, probably obese, man who had indeed had more than 70 abdominal surgeries. Unfortunately, at some point the skin and fatty tissue on his abdomen had become infected and been removed. The result was a square cut on his belly from the nipple line to his belly button, which extended across the entire stomach. It was perfectly square, with perfectly normal skin and fat around the cutout. And when he breathed, his abdominal muscles and intestines would just sort of come in and out from his abdominal cavity with each breath. He looked like something out of a zombie movie, but was apparently doing alright and living with it. He was attached to a machine called a wound vac that kept the wound clean and provided suction to remove any fluid, or in his case feces, that had developed in the wound. We were waiting for the day when he stopped leaking stool into the square to get him a skin graft. We were still waiting when I left the surgery service a month later. Story 10. A 20-something boy got shot in the head. Straight on, mind you. Dude came to the hospital awake and talking. I personally saw the CT scan with the bullet still in his skull. My favorite part was he claimed it was a drive-by shooting. I have never seen anything more centered on someone's forehead. Dead center, no joke. Seems highly unlikely that it was random. Story 11. A year ago, I was involved with treating a 65-year-old lady. Walking across the street to get lunch one day, she got hit by a semi-truck doing 45. Broke all the bones on the left side of her body, some of them in multiple places. She also had a Morel lavally, which is when the skin separates from the underlying tissue, that involved about 70% of her leg, from hip to ankle. She had a pelvic fracture that was open into her rectum with a large perineal wound, and it took multiple surgeries over several weeks, but at her most recent follow-up, which is a year after the accident, she was walking and basically back to normal. Story 12. Not a doctor, but my father is. In his first rotation of residency, he had to assist in operating on an 8-year-old boy. Poor kid's dad was chopping wood, and he got in the way of the swing. Axe was lodged deep in his skull when he first came to the ER. According to my dad, the boy survived, but the way he describes the father's devastation at having brutally injured his own son really makes me understand why my dad was always so uptight about things like fire, knives, and, of course, axes when I was a kid. Story 13. When I was about 8, my dad ran a trucking business, and he was moving one of the trucks. I thought he'd be super impressed by me running and jumping up on the step to say hi to him while the truck was moving. He immediately grabbed a fistful of my hair, pulled my head inside the truck, and slammed on the brakes. He slapped the shit out of me and called me all sorts of terrible things for like 5 minutes, all with tears streaming down his face and his voice cracking. Scared the hell out of me. I had never seen him so upset. Eventually, my mom came out of the office and grabbed me. I didn't see my dad at all for the rest of the day. He went and locked himself inside his office. Of course, I was crying as hard as an 8-year-old could, and I didn't understand why he flipped out on me so hard. All I could get from my mom was that I had done something very, very dangerous. Dad apologized to me the next day, but couldn't get any more words out without choking up, other than, "You scared the shit out of me, son." I still didn't understand that and thought I was the victim. It wasn't until years later that my mom told me the reason he went apeshit. He watched as his coworker's son had done the exact same thing years prior, only the dad driving didn't notice what was happening and kept going. The boy slipped off and was crushed by one of the wheels of the truck. My dad was just feet away from running towards them trying to get the guy's attention when it happened, and was full witness to the kid's head popping under the tires. I guess the kid died instantly, but the dad, one of my dad's best friends, ended up committing suicide soon after because he couldn't stop blaming himself. My mom said for years my dad had this weird stare and a sadness to him that he couldn't shake until I was born, and he seemed to go back to his old jovial self. She said that the day he flipped out, he had spent the rest of the night in his office crying with the same look on his face and wouldn't talk to anyone. To this day, he still won't talk about it, but I definitely understand now. Of course, it's wrong to hit your kids, even in that kind of situation. But I think what I did gave him flashbacks of the other kid dying, and it seriously blew some fuses in his brain for a few minutes. Needless to say, it 100% worked to keep me from ever trying some stupid shit like that again, where a stern talking to would have gone right out the other ear. Story 14. I had a dog brought in that had eaten a bunch of anticoagulant rat poison about a week prior. They didn't think anything of it at the time because the dog was fine immediately after. If a dog gets into an anticoagulant poison and you catch it right away, you can decontaminate them and give them vitamin K, and they'll usually be fine. By the time they decided their dog should see the vet, it was dripping blood from every orifice. In shock, and had a packed cell count of 6%. For some reason, they'd let me hospitalize and start vitamin K, but they would not let me transfuse that dog. It was bleeding from its freaking tear ducts. Too weak to lift its head, and I was so convinced it was going to bleed out in front of me if I couldn't buy it some time with some donor blood. That stubborn little pup pulled through though, and was going strong when I saw her a year later for her regular checkup. Story 15. My grandma's dad. That dude was in love with this girl, but hated her family, so they ran away into the woods. Little did they know her father ordered his sons to hunt him down and bring back the daughter. So they did, and meanwhile they put a bullet straight in his chest. But the bastard survived, and later on created a lineage with that woman. Also, he did many years in Goli Otok, the Yugoslavian version of a gulag, and survived everything. Truly one of a kind. Edit. That bullet stayed in his chest some 80 years later until his last breath. Story 16. Not a medical professional, but I used to hang around with one. They had a young woman brought in one night who had been stabbed 77 times and laid in a ditch for hours before someone saw her and called 911. She made a full recovery. My buddy was so shocked that she was alive and conscious that he called me from work just to tell me about it. And then there was a guy who fell off the third rung of a ladder, hit his head just right, and died instantly. Life is weird, or in this case, death is weird. Story 17. My dad survived diabetic ketoacidosis, massive heart attack, and kidney failure. Doctors told us to prepare for his death. We called the priest, brought all the family in, he was on life support for a week and kept improving. They gradually brought him out of it, and when he came to, he ripped out his tubes. The doctor who prepared us for his passing came back from vacation and saw my dad alive and recovering and said, "You are the last person I thought I'd see again." My dad blinked and asked, "Who is that?" He's still alive. Story 18. In nursing school, I had an elderly patient who had a Whipple surgery, a very extensive abdominal surgery to resect pancreatic cancer, and must have gotten perforated. It took 3 days of worsening redness before the order came in to remove the staple. I was helping out as the stench of blood, pus, and feces filled the room. The next month of clinicals included 7 times per day of dressing changes, pulling yards and yards of blood and feces-soaked packing out of the wound. And somehow this guy actually made it through. I have no idea how he didn't get septic. Story 19. The story of Mary Vincent is insane. She was a teenager and hitchhiking on the west coast of the US. Got picked up by a madman who SA'd her repeatedly over the course of a couple hours. Eventually, she fought back and grabbed onto his arm. When she wouldn't let go, he chopped her arms off with a hatchet and threw her body into a ravine. For hours, she climbed 30 feet up the side of the ravine, sans arms, and eventually made it to the side of the highway, naked, bloody, and still bleeding from the stumps where her arms used to be. Apparently, she scared the first car off when they pulled over for her, but the second car brought her to the hospital after her 2-day-long nightmare. She's still alive 20 years later and has 2 kids. Woman's a freaking badass. Story 20. Recently coded a patient for 40 plus minutes. Everybody wanted to stop, but he was young, in 50s, so I persisted. People don't come back from codes that long. Then, all of a sudden, he gets a pulse back. So we think this is temporary and wonder about anoxic brain injury. I leave service, come back days later, and smack dab on day 1, I see him discharged home in stable condition. He had a full-blown conversation and was so thankful, tearful, and kept saying, "Thank you for not giving up on me." He had no deficits. Mind blown. Story 21. My late grandpa had a hell of a story for this. He was crossing the road one night and got struck by a car. Police said when the car struck him, the force literally knocked him out of his shoes, and that from where the shoes were on the road was 60 feet away from where he had landed. He landed in the windshield of a car coming the opposite direction. He was taken to the hospital and was dead on arrival, resuscitated, and in a coma with severe brain damage. Doctors told my mum he was never going to wake up, and if he did, he wouldn't be able to walk or talk. Whilst in said coma, he died and was resuscitated twice more. Eventually, beyond anyone's belief, he woke up. And after weeks in the hospital bed, he looked out the window, pointed at the cars of the road, and said, "Football." He went on to make a near full recovery, with slightly slurred speech and not full movement in his left arm. but still far better than anyone would have expected. And he went on to live until the age of 80, roughly 30 years after the accident. I miss that guy. Story 22. My grandfather got shot 7 times, caught 2 shrapnel shards, which they took out from between his intestines with only some chugs of liquor as anesthesia, and he survived 5 years sleeping on a concrete floor in a Siberian gulag. That man lived to 83. Toughest person I know. My grandpa stepped on a landmine in World War II, which resulted in lost fingers and stitches in his lower arm that were done with toothpicks. He was made to run miles in the nude as a prisoner of war with these injuries, all the while hiding a journal in which he recounted every single one of these stories. Also, he was shot in the head and survived with no brain damage. There are other things that I can't remember anymore, but he was tough as nails. When I was 7 or 8 and he was in his 80s, he used to outrun me in races with no issue. And then a year later, cancer got him. He went from gardening and carrying 45-pound bags of soil to his deathbed in 2 weeks. Story 24. Had a guy come in with acute onset blindness in both eyes, did a blood gas which showed a pH of 6.6 and a bicarb of 0.5. To give some perspective for non-medical people, these numbers shouldn't be compatible with life. Normal blood pH is 7.35 to 7.45, and because pH is a logarithmic scale, this guy's blood was almost 10 times as acidic as it should be. The fact that he had no bicarbonate, the acid-base buffer in the blood, in his system reflects that he had exhausted his usual compensatory mechanisms. We were convinced initially that it was metanol poisoning, but all his toxicology turned out to be normal. He needed 10 days of dialysis in the ICU, but eventually made a full recovery. We never were able to work out what caused his severe metabolic derangements. Story 25. I had a friend who got to around 0.23 blood alcohol content and stole his friend's car around 2 a.m. drunk. He went for a drive way out in the country and lost control while speeding. Hit a tree and basically broke the car in half and rolled it 5 times. He got ejected and ended up being pinned under the car when it came to rest. He laid under the car for several hours until someone going to work early in the morning spotted him and phoned the EMTs. After a week in a coma, he woke up and did months of physical therapy to get back to walking, and eventually made a full recovery to the point that he was squatting almost 400 pounds. Story 26. Patient with a horrible lung infection from a chronic illness. Antibiotics are not working, and he continues to become septic. All other sources of infection are ruled out, and the team is confident that his blood infection is coming from the lungs. Now, the patient is also on a lung transplant list because of his chronic illness, so the team decides to remove his lungs without a confirmed donor and anastomosis his pulmonary arteries to his pulmonary veins. Then he's put on ECMO without any lungs in his body and his infection clears. About 10 days later, a lung donor becomes available and he gets transplanted. Wakes up about 3 days after that, very sick but very much alive. Lived without lungs for 10 days. My dad is a doctor, and while we were traveling with my mom's parents, we noticed my grandpa was walking poorly and depended on one leg more than the other, and also he was getting tired very fast throughout the day. Initially we thought maybe a stroke, but then my dad thought maybe it was a form of brain tumor. Luckily, as a doctor, I think he helped get a brain scan for my grandpa, and they found 2 very large brain tumors, one the size of a small baseball apparently, which were applying a lot of pressure and was also squeezing his optic nerve. So eventually they operated and took out the big tumor, which was risky given his age, and they left the small one in because they said it wouldn't be big enough to be a hindrance until he was like 103. So at this point it wasn't worth the extra risk to take it out. Somehow, his eyesight wasn't damaged at all. He can walk perfectly again, his stamina and endurance is 5 times better than it was before, and his attitude is incredibly positive at all times. Which, granted, I think is mostly because of the gratefulness that he survived, because everybody expected him to die after hearing about the tumor. I don't know if this is actually a rare occurrence, but it sounded pretty crazy to me. So that's it for today. Don't forget to leave your comment down below, because I'd love to hear more crazy stories. These were pretty insane, frankly. And if you like this content, feel free to like and subscribe. It really helps me out, and I would appreciate it a ton. Either way, you all have a great rest of your day, and I'll see you next time.